Hi, everyone. My name is Carlos Rivero, and I'm Chief Data Officer for the Commonwealth of Virginia. And it's great to be with you today at GovX Digital Virtual Summit. As the Chief Data Officer for the Commonwealth of Virginia, one of my primary initiatives is making sure that we're leveraging our data assets strategically across the Commonwealth. But in order for us to do that, we need to realize some very key performance benefits. First and foremost, we want to be able to improve the operational efficiency of our government agencies. Specifically, within the Commonwealth, we have over 63 executive branch agencies. So that's a lot of different organizations that are using data in a variety of different ways. So being able to create a strategic platform where these agencies can benefit from enterprise services that help them make better informed, data-driven decisions is one of the primary objectives of my organization. But in addition to that, it's also providing more citizen-centered services. One of the things that we strive as a government is to provide our constituents with the best government services possible. But there's a big difference between the services we provide and the outcomes that our stakeholders experience. And that's the last bullet, that's the last benefit that we work on, is providing better outcomes for our constituents. But the only way we can do that is if we're able to match the services we provide to the outcomes that they experience. And being able to have a data-driven environment, a data-driven culture that looks at that cycle, that longitudinal view of all of our different services and the outcomes that our stakeholders experience is one of the key ways that we can determine whether or not our services are meeting the needs of our constituents. But in order for us to do that, when I began this journey about 2 years ago, I decided that there were 4 main initiatives that we really needed to work on to make this data journey a reality or a success. The first and foremost is data governance. We wanted to make sure that we had the engagement and participation of all the key stakeholders in the decision-making process of how we leverage data as a strategic asset. So when we talk about those different entities, we're talking about the data stewards and their participation in the conversation, but also the Data Governance Council, as well as the Executive Data Board and a Virginia Data Commission. Now, the Virginia Data Commission is a very interesting entity because it involves state leadership from across the different branches of government, from not just the executive branch, but the legislative and judicial branch as well. And in addition, having geographic representation from across the Commonwealth, from organizations like localities, academic institutions, and technology councils. Being able to bring high-level state leaders together to look at overarching goals and objectives that we want to accomplish as a Commonwealth. For example, 10% reduction in overdose deaths, 10% reduction in recidivism, improvement in infant and maternal mortality, right? Being able to look at these overarching issues that no one single agency has complete purview or be able to move the needle on any one of these initiatives is the role of the Virginia Data Commission. But then ultimately, as they identify those overarching high-level goals and objectives, the idea is to hand those goals and objectives over to the Executive Data Board to be able to translate those objectives to agency-specific performance targets. So the executives that sit on the Executive Data Board each have agencies that they're responsible for. And within those agencies, they know what the business processes are that they can then leverage to move the needle based on those goals and objectives we defined for the Commonwealth. But beyond data governance, we want to make our data assets discoverable. We want to make our data sets available and accessible to a wide variety of different stakeholders across not just the Commonwealth, but the world, really. When you're talking about the different stakeholders that can take advantage of data assets that are in our open data portal, that's global, right? When we're talking about a variety of different stakeholders that can take advantage of our restricted use data sets, well, that could be local, regional, or statewide, right? So looking at the different types of stakeholders and making our data assets discoverable is what our enterprise data catalog is all about. Creating that internal process where our different agencies and their data stewards can register data assets into the enterprise data catalog, or what we call the Virginia data catalog, to be able to then say, these are our data assets that we have available, and then have a variety of different stakeholders like students, apprentices, vendors that are working on BI or data analytics projects go into the data catalog and be able to augment the documentation for those metadata assets in the catalog, completely separated from the firewalled network of those different agencies, because we are not all on the same network. Each agency has complete controlling authority over the networks that they maintain. And so being able to have a common environment where multiple organizations and multiple individuals can access that environment to create and augment our metadata values are incredibly important. And then be able to have an approval process where the data stewards can go in, approve the metadata assets, and then the data owners can publish those metadata assets to either the open data portal or our data sage environment, which I'll talk a little bit more later on in the presentation. So being able to discover our data assets is incredibly important as we move towards a more data-driven culture within the Commonwealth. In addition, we've also been working on trust, and specifically the Commonwealth Data Trust, which is that legal framework that allows us to share data with one another in a more meaningful and formal fashion without implementing a point-to-point sharing protocol, which I'll talk a little bit about that later on as well. And then lastly, talent, right? One of the biggest things we want to make sure we have is data talent across the Commonwealth. And that talent begins with students that are coming out of high school, going into community college, or even not even going into community college yet, just thinking about what do they want to do as their next phase in their lives, looking at bringing them onto the Rural IT Apprenticeship Program, which is a program that we developed with the Southwest Virginia Higher Education Center to incorporate students into the data documentation process. So that process of data discovery that I talked about earlier is leveraging that process to bring apprentices into the understanding of what are our business processes, what are the government business processes that are generating the data assets that you see in the data catalog. But then we also have the Commonwealth Data Internship Program, which is a program that's run out of our Virginia Innovation Program. And they essentially have a matchmaking service, if you will, for connecting students in colleges and universities to agencies that have problems in data that they want to share and solve, right? So while the agencies have problems they need to address and data assets that they can bring to bear to some of those problems, they don't necessarily have the human or technical resources to be able to do the data analytics and develop the business intelligence products that they need to help make them make better data-driven decisions. So as a result of that, we work with different universities and colleges and the research faculty and students therein to bring the skill sets, bring the tools that they have to bear on the problems that we're trying to address. So it's essentially, as I mentioned earlier, it's a data analytics matchmaking service that we're providing. And then lastly, working on a Commonwealth Analytics Fellowship, a data analytics fellowship, where graduates from the CDIP program that are now looking at becoming professionals in the industry can go back and be a fellow within an agency working as their data scientist for a year to get not just professional experience, but also to help that agency beef up some of their data analytics and data science capabilities as they embark on the projects that they're working on. So as I mentioned earlier, the Commonwealth Data Trust, there's a lot of words on the slide, and I'll let you read about them all later, but essentially the Commonwealth Data Trust is that legal framework that identifies the roles and responsibilities of each of the different entities involved in a data sharing relationship. So when you talk about data sharing, you're talking about an organization that's providing the data. Right? So that's the data provider, and essentially in the Commonwealth Data Trust, that organization is classified as a data trust member. But then you also have the trustee, which in this case is the Office of the Chief Data Officer, who's responsible and accountable for making sure that only those data assets and the data elements therein are shared with those organizations that have been given approval to access those data assets, and making sure that the individuals that are accessing those data assets from within those data trust user organizations are able to not just connect to the data and utilize the data, but not share the data beyond the intent of the data sharing agreement. So as I mentioned, the recipient of the data asset is the data trust user, and then the individuals that work for that organization that have their hands on the keyboard, eyes on the data, are the data trust individual users, and they also need to sign a non-disclosure agreement, certifying that they understand they have a personal responsibility for making sure that that data that we've entrusted them with maintained confidentiality and maintains the privacy of those individuals represented in that data set. So, one of the things that, well, I guess in the previous slide I failed to mention was that we have a lot of different project-based data trusts. We have the VLDS, which is the Virginia Longitudinal Data Trust, which connects educational services to employment outcomes. We also have the FACT Data Trust, which is our framework for addiction analysis and community transformation. which is our opioid project that we kicked off in the Winchester community about 2 years ago. But we also have the Workforce Data Trust, which integrates data from a wide variety of different workforce organizations to provide users or stakeholders that are out in the Commonwealth with access to different workforce services, whether it's certification, training, unemployment insurance, what have you, especially during this very critical time with the pandemic where a lot of individuals have lost their jobs. And then also, there's also the COVID-19 Data Trust, which we've been able to leverage the FACT platform to help us implement our response to the COVID-19 pandemic. But going back to that, those have been very specific project-based data trusts. And what we're working on now is creating a unified Commonwealth data trust that encapsulates all of those different projects into one environment and then makes it a more holistic data trust for all of the entities involved. So that we're not just project-based, we're looking at it in a much more holistic view. Some of the organizations that have contributed data to the data trust from the very beginning as part of the Winchester pilot included the Department of Criminal Justice Services, our local corrections, Virginia State Police as a statewide organization, but also have Community Service Board, again, a local organization in the Winchester community, the Virginia Department of Forensic Sciences, which is a statewide organization, the Winchester Police Department, a private healthcare system, and then U.S. Census and Bureau of Labor Statistics. So bringing in our federal partners as well. Bringing those into the data trust and formalizing the agreements with these organizations really builds up that trust component that is required in any data sharing relationship. And some of the impacts that we've had in the Framework for Addiction Analysis and Community Transformation project is that we've been able to empower community leaders to take immediate action on some of the events that are happening in their communities. Specifically, one of the anecdotes that was provided by the Drug and Gang Task Force leader at a Richmond overdose symposium earlier this year is that they were monitoring the dashboard or the intelligence dashboard that we provided to them on the different types of overdoses that are occurring, and that dashboard was getting updated every day. And through that dashboard, they were able to see that the number of overdoses that were being registered in their community was exceeding the baseline level that they're normally used to seeing. So as a result, he told his task force to stop everything that they're doing, go to the hospital and start interviewing those individuals that were suffering an overdose. And as a result, they were able to identify where those drugs were being distributed, executed a search warrant, and locked that down almost immediately. And so within a couple of days, they were able to lock down that drug distribution center overdose in that community. So that's a pretty powerful response, and the ability for us to be able to take the data and the intelligence that we derive from it and empower community leaders to be able to take immediate action to mitigate some of the issues that they're experiencing in their community. In addition to that, they were also able to receive a $1 million grant from an external foundation to help improve the services that they're offering at the community level. And in so doing, being able to prove that they're a more data-driven organization. So as a result, they created the Give Me a Reason program, which is a program that allows parents and caregivers and guardians with testing kits, test screening kits that they can implement in the privacy of their own home to determine whether or not their young ones are taking any substances at all. And as you can see on the slide, it screens out for 16 common drugs, but essentially what we're doing is that we're empowering these parents, these caregivers, these guardians to be able to take action when they need to take action. If they suspect that their child is taking drugs, that they have a way to immediately go get a testing kit and be able to go back home and determine whether or not it is true. But it also gives them an opportunity for them to have a conversation with their children about the importance of not taking drugs and staying away from drugs, and be able to curb any potential substance use issues that may happen in the future by addressing it early on. As a parent, you often wonder, what do you do if you suspect your child is taking drugs, right? And do you go to your doctor? Do you go to the school? Who do you talk to, right? So this gives them an opportunity to clearly implement the outreach and connect with those parents to give them the power, to give them the tools that they need to be able to take that action. Because at the end of the day, that's what we're trying to do, is empower action through data, right? Having that data in your hands and having the ability to understand when action is needed and be able to facilitate and give people the tools they need to take that action is what this is all about. So how did we leverage this platform for the COVID-19 response? And the reality is that, what we were doing in the Winchester community was not just implementing a project to address the opioid epidemic, but we were also testing out certain things that we wanted to see whether or not they would scale out. One of those things was the data governance framework, and be able to build in the charters for and the processes for how data governance needs to be implemented, especially when you're talking about a multidisciplinary project with stakeholders that don't all fall under the same organization, right? How do you get different stakeholders from different areas of the Commonwealth working together for a common goal? The other part of it is the Commonwealth Data Trust, being able to work through the legal issues in developing these large-scale agreements that incorporate all of the different components and relationships in the data trust, from the data trust member to the trustee to the data trust user, and ultimately the individual data trust user. How do we create that legal framework that connects all of those dots? And then lastly, the technology framework, leveraging a cloud-based data consolidation platform, building out the analytics on top of that, and then building out the intelligence platform that helps bring that intelligence back into the hands of the people that are making those decisions. So as you can see, we're thinking about real-time data and analytics delivered to the governor, his cabinet, and the VESP Unified Command to be able to guide decisions on where resources are needed and how do we need to respond to the changes in the COVID-19 response, right? And then measuring how we are recovering and responding to different reopenings. Do we have to take a more holistic approach across the Commonwealth and lock everyone down, or do we take a more geographically centered approach where we can identify with a lot of precision where these lockdowns need to occur? And so again, talking about the data trust now, because of the COVID-19 response, we have a variety of new data partners, right? We have the Department of Health, the Department of Emergency Management. We also have the Department of General Services with their Division of Consolidated Laboratory Service, a public health laboratory that we run at the state level. But we also have the Virginia Hospital and Healthcare Association, a private healthcare association that is not part of state government at all, but that is willing to join the data trust to help provide the governor and his staff with the intelligence they need to make better informed data-driven decisions. And the hospitals and the long-term care facility data comes directly from VHHA. But in addition to that, we also have the Virginia Department of Corrections for all of the state prison data, as well as the Compensation Board for all of the local and regional jail data. And again, we're leveraging data from the US Census to bring in from their American Community Survey to bring in population data for each of the different localities that we're working with. And some of the metrics that we're looking at obviously are cases and hospitalization and deaths, very, very key, key performance indicators that we're looking at. But we're also looking at the number of beds, hospital beds that are being utilized across the board and in different regions, different geographies. When you look at the very top, you see health districts, health regions, BDAM regions, jurisdictions, down to zip code level, right? We're able to get as granular down to the zip code level to be able to determine with a high resolution where these events are happening and how do we impact or how to respond to some of these events. And so, the utilization of beds, not just at the hospital level, but the number of patients, the percentage of patients that are COVID-19. And the same goes for ventilators and the same goes for ICU patients, being able to see what the demand on the system is as a result of the COVID-19 pandemic. And as you can imagine, early on, this was a very, very important thing. And now as we're looking at a resurgence of COVID cases, again, we're revisiting some of these dashboards on a regular basis to determine whether or not any of our healthcare systems are being overwhelmed by demand. But again, we're also trying to look forward in regards to the testing that we're doing, right? We're looking at testing capacity. So just like we were looking at healthcare capacity to be able to respond to the demand in any new cases, we're also looking at testing capacity. How many laboratories do we have running tests? How many of those are running at an optimal level? How many of them do need supplies to continue to function at an optimal level? How many tests can we get up to in a per day basis? And originally, we were doing less than 1,000 tests per day, and currently we're well over 30,000 tests per day, right? So these numbers are old. This is back in June, but if you look at the numbers today, they're much better in terms of the number of tests that we're able to conduct on a day-to-day basis. And then also looking at the percent positive per day. And you can see down in the chart in the bottom center, you see that our trend has been going down, right, over time. And again, this is as of June 28th. Obviously, it's been a lot of time since June 28th, and we've seen that trend continue downward. And now we're monitoring for that second wave of COVID cases that's coming. And so as we're looking at tests, but we've also looked at individuals. So in this case, we're looking at testing capacity. In another dashboard that we have, we're also looking at individuals tested and where are they tested, right? Are we having adequate testing across all of our localities in the Commonwealth? And in so doing, we've established two metrics that we're monitoring. One is the testing requirement and the other one is testing goal. And the testing requirement is testing 2% of your population for any given month. And the testing goal is testing 4% of the population in any given month. And so looking at those two metrics, we're able to determine whether or not any specific locality has been meeting their testing requirement or their testing goal. And then looking at how that compares with the prevalence rate in each of the different localities to determine whether or not we should be increasing our testing in that environment or decreasing our testing, and then adding, providing resources to other localities instead. A big part of what we're doing is actually trying to share this information with the public, because one of the key things that we're trying to do is empower individuals to make better informed data-driven decisions. And the Open Data Portal plays a huge role in that, in being able to take the data assets that the Department of Health is using to monitor the COVID-19 pandemic and ultimately guide its response, being able to provide those data assets through our Open Data Portal to any stakeholder that wants to be able to access that data. Not just manually, you go onto the data portal and you download it, but you can also access it through the API interface. And so that you can develop your own applications and utilizing machine readable format to be able to access that data on a regular basis, update your own application, and create your own intelligence. So ultimately what we want to do is really empower everyone to be able to make the most informed data-driven decisions possible. And so as a result of that, you can also view and create stories, visualizations, filter data, as I mentioned earlier, access it through APIs, but you also have the feature of suggesting a data set, right? Being able to identify where are some of the data assets that we could be providing that you as a stakeholder would like to see, and then being able to initiate that conversation with the different agencies that are responsible for those specific data assets to bring them to the table and say, hey, this is a need that's been identified on our Open Data Portal. How can we solve that need? Is there a way that we can make that data available on the Open Data Portal? And then lastly, looking at not just open data, but also restricted data, being able to develop an environment, which in this case we call DataSage, our secure analytics and governance environment, to share restricted use data to a wide variety of different stakeholders. Now, if you can see on this chart, and there's a lot going on, I'm not going to get into all of it, but essentially what we're looking at is being able to connect agency data assets down at the bottom level, right, where you have each of those different database drums at the bottom level describing each different agency that has data assets that we want to make available to the stakeholders that you see at the very top. We see the government agencies, law enforcement, medical professionals, innovative research, academia, higher education, community leaders, and the public. Right? Being able to provide each of those different stakeholders with access to either open data assets or restricted use data that allows them to make better data-driven informed decisions and help us as a Commonwealth improve our ability to respond to these types of complex events. Right? And as you can see, there's a lot going on here, but I talk a little bit about data discovery, which is that centerpiece where you see the enterprise data catalog and the register and the data stewards and the student apprentices and publishing to the Open Data Portal. There's a lot of these components that feed into what I just talked about for the 4 different initiatives, and then building out the data trust and building out our ability to leverage intelligence to make better data-driven informed decisions. And again, all of this is supported by that Data Governance Council that I mentioned earlier as our governance framework. Please feel free to sign up for Bits and Bytes, our CDO newsletter at cdo.virginia.gov. And with that, I thank you very much for listening, and I look forward to taking your questions in the panel discussion coming up shortly.